There is a massive movement happening within the longevity and aging landscape. It turns out there is much we can do to extend our lifespan and reverse the effects of aging. What we've been taught and led to believe about aging and human disease are now outdated and no longer accurate. That means it's time to change the current mainstream paradigm and have different kinds of conversations when it comes to our well-being. And it's time to recognize that we have the power within ourselves to dictate and drive our own health span and aging journey. Hi, I'm Suzaida Hippolito, host of Timeless Vitality, where we are redefining aging so we become truly timeless. We've all been touched by breast cancer, whether we got the diagnosis ourselves or someone we love got the diagnosis. Here's the deal. What we've been told about breast cancer is inaccurate. And in this episode, we unpack the inaccuracies and discuss the real truth behind breast cancer. Our speaker today spent 20 years of her career as a breast surgeon and leading cancer care in the state of Philadelphia until she was confronted with her own illness. For years, she would prescribe chemotherapy and radiation to patients without any hesitation. But when this form of treatment for her own diagnosis was presented to her, she said no, it wasn't right for her, and she left conventional medicine. This placed her on a self-discovery journey and healing path. Now, as an integrative oncologist, speaker, author, podcast host, summit host, and founder of Real Health MD, she is on a mission to change the impact of breast cancer by empowering millions of women to take control of their health and well-being and design the life they want. Please meet Dr. Jenn Simmons. Dr. Jenn, I'm
Thank you
so
so much
happy
for
to
that
have you
beautiful
here.
introduction. That was beautiful.
Aw. Well, I'm so excited to have you here and have this very necessary conversation. And where I'd like to start is tell us about this confronting moment. As I was learning that about you, I was covered in goosebumps all over my body. Like it was so resonating with me. Tell us about that confronting moment.
Yeah, there's nothing like a life-threatening illness to really make you take stock in your life and get some perspective. So, me being a breast cancer doctor was a very natural evolution to my life. I come from a breast cancer family. There's not a time in my life where I didn't know about breast cancer.
Mm.
Growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She was beautiful, brilliant, larger than life, lit up a room, the queen of Motown sound. And she wrote 54 hits in her career, in her very short career. Her most famous song was The Greatest Love of All. So she wrote
Mm.
that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali, but it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know because she died of metastatic breast cancer. It's
Mm.
crazy that 50 years later, I can't tell this story. She died of metastatic breast cancer 1 month after Whitney released that song.
Wow.
Her life and her death gave birth to my life's purpose because I never wanted another woman, another family, another community to have to suffer like ours suffered. And I wanted to do everything that I could to change the conversation around breast cancer. So I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. And for a really long time, I worked at the top of my field doing innovative things that no one else was doing. And I
Mm.
felt really good about the contribution I was making. And about 15 years into my career, when I'm at the top of my game, I go from probably being one of the most high functioning people you could ever imagine to I can't walk across the room because I don't have the breath in my body. And I undergo this
Wow.
3-day intensive workup, and I'm sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo radiation, and I'm going to be on lifelong hormone replacement. And I'm having an out of body experience. I mean, these are the things that I said all day,
Mhm.
every day. These are things that I told women to do without hesitation or reservation. But when those words are coming at you, when this is your future and your destiny, and part of it kind of made sense. Even though I didn't have a breast cancer diagnosis, even though we were talking about thyroid disease and not breast cancer, I always envisioned that this would happen to me at some point, that I would come to
Mhm.
some impasse. I thought it was going to be breast cancer. And for
Mhm.
me, my aunt, um, who is who I most resemble, she was diagnosed with Graves' disease 10 years before her breast cancer diagnosis. So for me,
Mhm.
this was all the writing on the walls.
Mhm.
And call it God, call it universe, call it whatever you want to call it. Something about me said, this isn't the way. This
Mm.
isn't the path. This
Mhm.
isn't what you're supposed to be doing. And, my doctor told me what I told women all the time.
Yeah.
I told
Wow.
women all the time if they didn't treat their breast cancer, they would die of their disease. And he told me I would die of my disease.
Mm.
And I just inherently believed that that is not what God intended for me. And I
Wow.
walked away and I went on a journey of self discovery. I want to be clear, this was not about taking better care of my patients. This was all about me and figuring out if there was a different way for me to do it for me.
Mm.
And very early on in my journey, I enrolled in a certificate program, a coaching program called IIN, the Institute for Integrative Nutrition. And it's one of the first talks. And this tall, lanky guy with a big, toothy grin walks on the stage. I'd never seen him before in my life. And he introduces himself as a functional medicine physician. Now,
Mhm.
this is 2017, and this man is Dr. Mark Hyman.
Mm.
Now, at the time, that name meant nothing to me, although
Mhm.
he had already written many best selling books. Now I know him as the figurehead of the functional medicine movement.
Yeah.
But, all that was going on in my head at that point was there's no such thing as functional medicine. Like, what is this quack talking
Mm.
about? And then I remembered that I was sick and that I was there for a reason. And so I
Mm.
kind of checked my ego at the door and
Yeah.
shut up and listen. And thank God I did, because
Mm.
that talk that he gave that day was virtually telescoping the rest of my life.
Wow.
And it not only led to my discovery of functional medicine and my adoption of functional medicine, but it
Mhm.
was that day that changed everything for me for the rest of my life and the rest of my career.
Mhm.
Because once you understand the functional medicine principles of root cause illness, and once you understand, especially as a cancer doctor, that the cancer isn't the problem, the cancer is the symptom of the problem,
Mm.
that's a bell you can't unring.
Mhm.
And it took me 3 years to heal. My healing was not linear. It was not easy. I don't recommend it. I did way too much of it alone instead of getting help and
Mm.
having someone facilitate my healing journey for me the way that I do for others now. But once I was on the other side of that, once I reclaimed my health, once I understood what is important,
Mhm.
I couldn't go back to being a surgeon and just being part of the problem, because that's essentially
Mm.
what conventional medicine is.
Mhm.
A really, really good doctor is someone who recognizes a constellation of symptoms, gives a diagnosis, and prescribes a treatment. That's what a really good doctor is in the conventional medical world. In the conventional medical world, there's no drive for health because there's no way currently to reward doctors for having healthy patients. Because if their patients are
Mm.
healthy, they don't
They're
make
not
any
coming to
money.
see him. Yeah.
And so it's so fundamentally contradictory to how I feel, how I see the world now, how I how I view medicine and health that I couldn't stay in that system. And
Mhm.
so in 2019, despite the fact that everyone thought I was crazy, my colleagues thought I was crazy, or they thought that I lost my skills. My best friend told me I couldn't do it. My husband told me I couldn't do it.
Mm.
And at the age of 50, I walked away from everything and started
Wow.
Real Health MD with the intention to truly change the conversation around breast cancer and change the
Mhm.
way that we diagnose, treat, reverse, and screen for breast cancer. And that's
Mhm.
what I'm on a mission to do.
Well, it's fascinating that even someone of your caliber at the time, you talk about, well, let me back up. In your journey, what you decided was to reclaim your health. Those were your words. You reclaimed your
Yeah.
health. So that to me suggests that even someone at of your caliber at the time before you went on this journey, you didn't feel you had that power around your own health. Tell us about that piece.
Well, we are so conditioned to farm out our health, right? We're farming out our health to doctors, we're farming out our health to hospitals, um, to the various programs that are set up within the hospital structure. And we're entrusting our health to people that don't know how to create health. They don't know how to promote health. And
Mm.
so it's really a backward system. And if you think about it, health doesn't happen in a doctor's office or a hospital or a chemotherapy
Mhm.
suite or a radiation suite. Health happens at home with all of the practices that you put in place in your home to create health.
Mm.
So as I was going through my training and in practice, you're very much walking down a tunnel.
Mm.
You don't see the landscape. And in our training, again, we're trained to recognize symptoms and give a diagnosis. And the really good doctors in my space, right, the really good breast cancer doctors, they could see things on mammogram that other people couldn't see, or see things on MRI, or in my case, be a really good surgeon. Meanwhile, not thinking about the fact that, take screening mammogram, for instance. We're using a study that causes cancer to screen for cancer. So we're taking a population of healthy people, because that's what the screening population is. We're taking a population of healthy people and exposing them to radiation, or in the case of MRI, exposing them to gadolinium. So we're contributing to the decline or the demise of their health, and we're really damaging
Mhm.
people. But when I was in it, I couldn't see that. And
Yeah.
I believed what I was being told, and I believed what I was being taught. I believed that
Mhm.
mammograms save lives, and it wasn't until I got out of that system that I realized, hey, wait a minute, do mammograms really save lives? And how is that happening? Because we're exposing people to radiation 1, 2, 3 times a year in a very focused way. You know,
Mm.
it, a lot of the argument that we get from industry and from conventional medicine is, oh, it's the same amount of radiation that you get when you fly cross country. That may be
Mm.
true, but there's a big difference between the scattered radiation that you get when you're on an airplane and the focused radiation that you get when you get
Mm.
an x-ray focused on your breast. And it
Mm.
wasn't until I call it, taking my blinders off, because it wasn't until I was outside of that system that I could
Yeah.
start to see the truth. And the truth is, mammograms do not save lives. They cause a significant amount of cancers every year. And beyond that, they miss cancers in women who need them diagnosed, and they find lesions in people who don't need them diagnosed, and it leads to overdiagnosis and overtreatment, which costs
Mm.
hundreds of thousands of lives every year. So being having left the system was really the best thing that ever happened to me for
Mm.
so many reasons. But
Mhm.
beyond that, it now gives me the opportunity to really help millions of women in a way that I
Mhm.
would have never been able to do as a surgeon. Never.
Yeah. Yeah. Well, and you often are talking about creating health. So, how do we think of health in the conventional sense versus the way in which you refer to health
Yeah,
now outside of the system?
absolutely. You know, probably o- me- over 90% of women who come to me, and everyone comes to me with a breast cancer diagnosis. I'm still waiting for the people to come to me saying, how do I prevent getting breast cancer? But I only see
Mm.
people when the horse is out of the barn. Most of the women, the vast majority of the women that come to me with a breast cancer diagnosis, their opening line to me is, I'm healthy, but I have breast cancer. We are
Mm.
so disconnected from our health. And the reason that we're disconnected from our health is because we think of health as the absence of disease. But health
Mm.
is not the absence of disease. Health is optimal function. And there is a whole spectrum between optimal function and disease or failure.
Mm.
And what our current medical doctors don't know how to recognize is when you're falling off optimal function. And they
Mm.
only recognize when you've failed. So, for someone
Interesting.
who has insulin resistance and their fasting glucose is starting to increase and they're losing their metabolic health, what do we say? Come back in 6 months. Come back in
Mm.
6 months. Let's just follow you. What we
Yeah.
need to be saying is you need to change your diet, decrease your glycemic load, move your body more, use things like berberine or things that increase insulin sensitivity, because this can be reversed. And I don't want to wait for someone to become
Mm.
diabetic or
Yeah.
worse.
Mm-hmm.
I want to find that person that is just starting to lose their metabolic health and help them to reverse it. Because the name of this game is to live as long as you can and
Mm-hmm.
die young, right?
Mm.
That's what we all want. We do not want the last 20 years of our lives spent running in and out of hospitals or being debilitated or living in a nursing home. Like I know JJ Virgin says she wants to be relevant at 100, and she will be,
Mm.
because she is doing every single thing that you need to do to preserve your health. And her
Mm.
body will be working, her mind will be working because
Mm.
she's making sure of that. And
Mhm.
that whole tale about, oh, you're tired, you're just getting older. You're gaining weight, you're just getting older. This isn't true. We have normalized a whole host of disease states because our doctors don't know how to drive health. But when we
Mm.
look at the blue zones, the areas around the world where people live well into their 10th or 11th decade, it's because they've maintained relevancy. They've maintained health. They're walking every day. They're planting their own food. They're lifting heavy things, because anyone
Mhm.
who does gardening knows you're lifting heavy things all the time.
Yeah.
Maintaining muscle mass, maintaining connection to people, to community. I mean, we discard our elders, right? You're 65 or whatever, retire. We don't need you anymore. We'll replace you. In those societies, those people aren't replaced. Those people are revered.
Yeah.
That's the experience. They're the ones with the magic. So we really need to take a lesson from these places, these blue zones, on how to live life. Because
Mhm.
right now, our medical system is going to be destroyed by the people with their last 10 years of their life consuming most of the medical expenditures.
Mm.
And it doesn't have to be that way, but it's the only way if we continue to live the way that we're living as Americans now,
Yeah.
where over 90% of Americans are losing their metabolic health. This is not a recipe for success. This is a recipe
Mhm.
for sickness. This is a recipe for failure.
And speaking of that, I mean, you touch on a really good point that we think this way of life as we get older is normal, that the disease progression is normal because it's what we've been told, and it doesn't have to be that way. And especially as women, what we're challenged with as we get into our 40s are the metabolic imbalances, the hormonal imbalances. What can we do to start reversing some of those effects now?
Yeah. Well, the best way to do it is to not have that deterioration happen. So I am a huge believer in hormone replacement, and I think that that hormone replacement needs to start early. The very best thing that we can do as physicians and providers is talk to our patients and listen to our patients. I'm not a
Mm,
huge fan of hormonal testing in the perimenopausal woman because the fluctuations can happen even on a daily basis. But listen to them. Are they not sleeping? Are they not staying asleep? Are there blood sugar issues? But are there progesterone issues? Are they bleeding too
mm,
frequently? Are they bleeding too heavily? Women can tell you. Are they having hot flashes? We know what all the various hormones do. So if you just listen to your patient, you'll know what they need. And in the perimenopausal stage, which is, the average age of menopause in this country is 52. And menopause is a 10-year process. So, we need to be talking to our women when they're in their late 30s and early 40s, and
mm,
listen to the symptoms that they're having and help
mm,
them to not only manage the symptoms, but maintain their health. We know that within the first 10 years after menopause, there is rapid deterioration of cardiovascular health, of um, central nervous system health, of brain health, of bone health, of joint health. These things can be completely avoided. We can avoid the cardiac disease. We can avoid the cardiovascular disease. We can avoid the
mm,
dementia, the Alzheimer's, the depression, the anxiety. We can avoid the arthropathies. We can avoid the osteoporosis. But it means working with your patient as they're going through this phase of life and
yeah,
providing them with bioidentical hormone replacement. And there is no good reason to not be having this conversation. Estrogen doesn't cause breast cancer. It's a ridiculous notion. It has been proven otherwise. If you believe that estrogen causes breast cancer, then you have to believe that women were put on this earth for the sole purpose of getting breast cancer. It is a
mm,
ridiculous notion. Estrogen does not cause breast cancer. Estrogen is the hormone of life. And really,
mm,
when we stop making estrogen, when our ovaries shut down, that's really when the rapid deterioration happens. That's when we really start dying. And we have the technology to prevent that. But we have
Mhm.
to be partners with our patients, and we have to go back to rapid use and adoption of hormone replacement. And the
Mhm.
Women's Health Initiative has done unspeakable damage to decades of women.
Mm.
Decades. And
Mhm.
it's time to unlearn that nonsense and put
Mm.
that whole nonsense to bed and
Yeah.
help women because they need help. And it shouldn't be through giving more antidepressants or more lipid lowering agents or more antihypertensives or more
More
bisphosphonates for the
drugs. Yeah.
bones. It shouldn't be. We don't
Yeah.
need 6, 7, 8, 9 drugs to manage what hormone replacement manages. I,
Mhm.
I heard a statistic yesterday about the amount of money that is spent on Holter monitors for women who are going through menopause and have
Mm.
palpitations when they could be for pennies a day just getting hormone replacement.
Wow.
It's so crazy. It's so
Mhm.
crazy. And it's because our doctors don't know enough about being healthy. And
Yeah.
until we realign the system to promote health instead of rewarding disease, they're not going to know how to be healthy.
Mhm. And where would you suggest women go if they are to start thinking about hormonal replacement therapy now that isn't based on a pharmaceutical drug?
Yeah. So, well, I want to be clear if you're going to do bioidentical hormone replacement, it's still synthetic hormone, right? It's not, it's not it's bioidentical in that the chemical structure is the same, but it's still
Mm.
made in a lab. It's still a pharmaceutical. And
Okay.
this is a conversation that whoever your doctor is, if it's a gynecologist, if it's a family medicine doctor, if it's an internal medicine doctor, they
Mm.
should be having this conversation with you. If they're not, there is a world blooming and blossoming with integrative oncology, with integrative gynecologists,
Mhm.
and that is someone that you should make sure that you are starting to partner with.
Mm.
Most conventional gynecologists, if all they did was a traditional OBGYN residency, they don't know enough about hormones. But
Mm.
there are a lot of people who have gone back for further training, who have made sure that they understand female hormones
Okay.
and that they are trained prescribers.
Yeah.
And so that's someone that it's really important that you work with. For my part of it, I, at every opportunity I get, talk about the safety of bioidentical hormone replacement, including in the breast cancer population. Because people who have had breast cancer are people too, and they don't deserve to suffer. I think my friend Annika Becca said it best when she said that menopause is mandatory, but suffering is optional. And you
Mm.
do not need to suffer. And if you are suffering, you should make sure that you go to see someone who can help you.
Mhm.
There, there should be no reason for women to suffer anymore.
Mhm.
And there is no reason to avoid bioidentical hormone replacement. It is perfectly safe. It will protect the heart. It will protect the bones. It will protect the brain. It will protect the
Mm.
joints. It will protect the bladder, the skin, the vagina. I mean, it's really important.
Wow. Yeah.
Really important. There's a reason why we have estrogen receptors everywhere in our body.
Mm.
It's
Mhm.
because estrogen is the hormone of life. And we want to continue to function optimally and live really long and die young.
I love that. Live really long and die young. Now, within the context of the, let's just say, the old paradigm or the old system, what would you say is the number one belief that many of us get to unlearn in order to open ourselves up to this whole nother paradigm of integrative medicine, or West or Eastern, not Eastern, but more of the approach that you've taken, the holistic way.
Yeah. So I stand on three soapboxes, right? The first soapbox I stand on is that mammograms are not safe and that no one ever needs another screening mammogram ever again. The
Mm,
more mammograms you have in your lifetime, the higher your risk is of getting breast cancer. So we need to unlearn that mammograms save
mm,
lives. It is simply not true.
God.
The second soapbox that I stand on, we already talked about a little bit today, and that's that estrogen does not cause breast cancer.
Mm,
Estrogen is the hormone of life. It is impossible to be healthy without estrogen. We know that in those first 10 years after menopause, there is rapid deterioration of your health, to include your heart health, your brain health, your bone health, your vaginal health, your urinary tract health, your skin health, your eye health, all of it. Estrogen does not cause breast cancer, and everyone should be evaluated for bioidentical hormone replacement when they are in that perimenopausal window. So, those are my one and two soapboxes. The third one is that the only person that can make you healthy is you. And we
mm,
need to stop farming out our health to people who do not have our health in mind. When you go to see your doctor and he evaluates you for whatever symptoms you have and prescribes that drug to suppress the symptom, pharmaceutical companies are not about cures. They are not creating cures, and that is across the line. They are not creating cures. They're not researching to create a cure for cancer. It's the last thing that they want.
mm,
They want to manage your symptom and give you a new
God.
one. They are creating customers. So at the end of the day, we all have to take a supreme interest in our own health. Health
Yeah.
happens at home, and the only person that can make you healthy is you.
Mm, mm. It's so powerful. It's definitely, those are words that are giving power back to us, giving power back to the people to take charge of
Power
our
to the
own well
people.
being. Yeah, power to the people. Mission accomplished. Now let's go execute. Let's execute. Well, now, one of the things that you've also invented is a type of breast cancer screening that that doesn't include a mammogram, and it's called perfection imaging, I believe, right?
That's the
Tell
name
us
of my
about that.
company.
Okay.
I did not invent this technology. So, this technology was invented by a physician named John Clock.
Okay.
He is beyond brilliant and responsible for a number of medical inventions. This just happens to be his latest and greatest. And what this technology does, what this scan does, is it sends circumferential sound waves through a water bath, through water as the medium, and it creates a 360-degree image of the breast that has 200,000 times more data points than MRI
Mm,
and 40 times the resolution of MRI, without pain, without compression, without radiation, and it is fast, safe, and affordable. It is so safe that we can image infants, we can image pregnant women.
mm,
It doesn't matter because there
wow.
is no danger associated with this technology. There's no sedation that is needed. It is 100% safe. I am rolling it out across the country and assisting them in rolling it out across the world. I want to be clear my company, Perfection Imaging, I am not part of the technology. I don't own the technology. I just believe in the technology and know that this is going to forever change how we
Mm,
image the breast and ultimately forever change how we image the body. So
mm,
this first generation machine is poised to replace mammogram, ultrasound, and MRI. But eventually, the next generation machine, which will image the whole body, will replace everything.
mm.
So I'm just so excited to be
Yes.
involved on the ground level and the grassroots rollout of this technology. I know that it's the best thing for women, and that women are going to love it and adopt it quickly. I already have a list of thousands of women on my waiting list, and I haven't even opened my first location yet. My first location will open in June, but after that, they will open frequently.
All right.
So it's really, really exciting, and I know that this is going to be the legacy that I'm leaving behind, and I feel really proud and honored to have played even this small pivotal role that I'm
Mm.
playing in changing how we do things. And
Yeah.
like we started off talking in the beginning, you can't take the normal, healthy population and expose them to danger.
Hmm.
And if there's one thing that I want to make sure of, it's that we don't create any more disease.
Yeah.
We are living in times where we are surrounded by so much toxicity. We are not living on our grandmother's earth. We're not even living on our mother's earth. And the number of chemicals that we are exposed to on a daily basis is exponentially more than even 10 years ago.
Mm-hmm.
We have enough danger ahead of us. We don't need to add to that. We
Yeah.
have to do everything we can to eliminate those dangers in our
Yeah.
world and in our
Yeah.
system. And
Hmm.
the two biggest dangers that we need to eliminate for women in terms of breast cancer screening are mammogram and MRI.
Hmm.
And I'm
I
just
mean,
so honored to be a part of that.
just with this new technology alone that's being rolled out, I see the vision for massive reduction in the number of breast cancer diagnosis. Like that's
Not
where we're
only in the
headed.
number of breast cancer diagnosis, but also in the number of biopsies that are performed, because this is the only
Hmm.
functional imaging on the
Hmm.
market, meaning that, currently, if you see something abnormal on an MRI, people are forced into biopsy to determine what it is for diagnostic purposes. With this imaging, it has functional capability, meaning that we can bring someone back in 60 days, re-image them, count the cells, and get a doubling time. And we know that cancers have a doubling time of less than 100 days. And things that are either not cancer or not meaningful have a greater doubling time. So if you have a greater doubling
Hmm.
time, we just say,
That's a
see
good
you in
thing.
1 year.
Yeah,
So all,
it's a good
75% of breast biopsies that are done for benign disease. This eliminates that. This
Wow.
eliminates all those women having
Wow.
unnecessary biopsies.
Yeah.
This eliminates the overdiagnosis and will
Yeah.
eliminate the overtreatment. And
That's
this is a really
huge.
important step towards improving our
Mhm.
health, because
Wow.
treatment for breast cancer is not benign. Treatment for breast cancer actually decreases your life expectancy, and it's not because they're
Hmm.
dying of breast cancer. Women who are treated for breast cancer are dying 2 to 3 times more frequently from heart disease than their counterparts who aren't. Now, part of that is that it's the same inflammation that leads to breast cancer that also leads to heart disease. But the bigger part of it is that the treatments for breast cancer accelerate heart disease.
Hmm.
Radiation accelerates heart disease. Chemotherapy accelerates heart disease.
Yeah.
Anti-hormonal therapies accelerate heart disease. We are
Yeah.
creating a bigger problem
Creating
for
more
women than
problems.
they had.
Yeah.
And
Yes.
when
Wow.
you look at the cardiac statistics, in every decade of a woman's life past 30, she is dying exponentially more frequently of heart disease than she is of breast cancer. We need to
Yeah.
stop damaging women's hearts. Women's hearts are having a hard enough time. We need to stop damaging their
Wow.
hearts, especially in the course of a treatment that is not saving anyone's life.
Right, right. And this is so mind-blowing that this is the system that we've created as a
Mhm.
society that we've
Yep,
perpetuated for years. And
yep,
thanks to you and the catalyst that you've been, we're changing all of that. And this is, I think, a beautiful segue into how this kind of change, stepping outside of the system, taking control of your health, is one of the ways to be able to promote your own longevity and actually live a long, happy, healthy life. And with that, Dr.
100%.
Dr. Jenn, there are 3 questions I ask all my speakers at the
Okay,
end of our interviews.
okay.
The first question is, what is your number one life hack for promoting your own longevity?
Well, I always say that for me, because I was in a place where I was faced with my own mortality at 47 years old,
Mm,
um, I walk the line.
mm,
So I don't indulge in the things that most people indulge in. I eat clean. I move my body every single day. I prioritize sleep when I'm not writing a book. I'm not perfect, and I'm not saying that I'm perfect, but that I make sure that I follow the rules most of the time. I have
mm,
completely cut down my beauty routine. I only use clean products. I use very few products. I'm careful with what I clean my house with. I'm careful about drinking filtered water. I'm careful about only drinking out of safe vessels. I, I'm doing it all. And I'm not
wow.
saying that everyone has to do it all, but remember, I didn't do this all at once, right? Like, now I have air filters in every room in my house, but I didn't have air filters in every room in my house the day that I
Mm,
started off. And so
mhm,
for my advice for people is, as you run out of different products, the things that you're cleaning your house with, the things that you're putting on your skin, the things that you're, food that you're shopping for in your house, when you're given the opportunity to make a better decision, make a better decision. And before you
yeah.
know it, a year or two will go by and you will be surrounded by a way healthier environment. It's not going to
Mm,
happen at once. It's not going to happen overnight. But remember that this is not a sprint. This is a marathon. Life is a
mm,
journey, and health is not a destination.
got it. It's so good. Make
All right,
make
that's
make
one question.
make the different decisions, make the
Yeah,
different
just make a
choices.
better
Yeah.
choice each
It's
time.
moment by
I'll tell you
moment.
that my
Yeah.
my next choice, I haven't gotten rid of my old mattress yet, because that's another thing that I struggle with is as I get rid of things, I don't want to add to our burden, right? So I'm going to use my mattress until it's time to get a new mattress. And when I get a new mattress, I'm going to get an organic mattress. But I'm not sleeping
Mm,
on an organic mattress right now because you can't do it
mhm.
all at once, and I don't want to create
Yeah.
more waste than I have to.
Yeah. And I think I really like how you presence that, because sometimes we want to change everything all at once because we want the results right away. I know I've been guilty of that. But the truth is it's a stepwise fashion.
Yeah.
There's like it's like little by little, day by day, decision by decision, like you
Yep.
say.
Exactly.
Mm,
Exactly.
the next question is this: where do you see the future of human longevity?
Oh, well, I think that what we need to do is kind of abandon this mindset. We talked about this a little bit of farming our health out to doctors, to
Mm,
hospitals, to anyone else. Longevity is only going to come when we take control of our own health, because no one
mm,
is going to know you better than you, and no one is going to care about you more than you.
yeah.
And for me, I'm just thinking about keeping me healthy and keeping my family healthy. And what
Mm,
I'm mostly thinking about is avoiding the doctor, is avoiding the system, right? And do I do all the things every day? No, but I try to. I try to do as much as I can, but it's mostly about taking responsibility for your health and
mm,
also
yes.
being in touch with yourself, because so many people say they didn't even realize that they could feel this good. They didn't even realize that it was possible to
Yeah.
live without pain. They didn't even
Mm,
realize that it was possible to not be bloated or tired or achy. They didn't realize
mm,
that. And
yeah.
it's only when they have a taste of what it feels like to be healthy that they
Yeah.
can then be inspired to stay in
Yeah.
that place.
Then they can know, they can have a taste of that vibrancy, of that
Yeah.
wellness. Yes.
Yes.
And then that path, once you have a taste of it, it's addicting. It's like, okay, how can I get more healthy?
Yeah.
How can I have
And it
more energy?
And it makes it a lot easier to say no to that glass of wine or that piece of cake,
Mm,
or whatever
it does.
whatever your kryptonite is. It makes it easier to say no to that, because you feel so good and you start to associate those other things with not
Mhm.
feeling so good. I can
Yeah.
tell you that I've been, for the last probably 7 years, in a battle with my son. And I would tell him, you cannot eat gluten. You cannot eat gluten. It's not good for you. I can see it on your face. I can see what you look like before and after. You cannot eat gluten. And for years and years and years, we battled. And this year, he decided that he wanted to get healthy.
Mm.
And he completely changed his diet. He completely changed how he is exercising, how he is moving. And every now and again, he'll be out with his friends and they'll go out for pizza. And he'll wake up the next day and say, Mom, never again. Never again. Because he
He
knows now,
knows.
now
Yeah.
he knows what it
Yeah.
feels like to feel well. And he
Yeah.
also knows what it feels like to wake up with brain fog and a puffy face
Mhm.
and achy
Mhm.
joints.
Yeah.
And for an 18-year-old to have that kind of insight, it's pretty amazing.
Yes, it is. He can
It is.
choose. It's a
Yeah.
choice.
Yeah. And
Amazing.
usually kids don't have that kind of maturity. But adults who have had the opportunity to feel what it feels like to really be alive, to have
Mhm.
vibrant health, to have energy,
Yeah.
once you have that, you don't want to let it go.
Absolutely. Absolutely. And the third question is this, and thank you for that, by the way. The third question is, what thought or act takes you back to a childlike, playful state?
Oh, music for me,
Oh.
100% music. Um, I come from a musical family, and it was ever present in my childhood. My parents were
Mm,
awesome dancers. They're still great dancers. And,
mm.
at the right song comes on and I am a smile from ear to ear, and I love being on the dance floor. So that for
Mm,
me is like, it
yes.
just
Oh
transports me right
my God,
back to my
so
house
good.
with the records playing and everyone dancing, and yeah, takes me right
So
back.
good.
Yeah,
There you have it.
yeah,
And I know, Dr. Jen, you also have a gift for our audience that they get
I
to download
do.
for free. Tell us
I
about that
do.
gift.
Yeah. So I have the Breast Owner's Guide to Health for all of you.
Mm,
And at the end of the day, breast health is health. And the same things that you're going to do to have healthy breasts
mm,
are going to give you a healthy heart and healthy brain and healthy bones and healthy
mm.
gut and healthy
Wow.
muscles. And so I just wanted everyone to have the ability to access it and, accept the challenge of being the steward of your own health, of being your own guide, of putting yourself and your family first. Because remember, when you get healthy, everyone else around you get healthy too.
Yeah.
Your spouse gets healthy, your family gets healthy, your friends get healthy,
Mm.
your community gets healthy.
Wow.
And our health is really our way of giving back to everyone around us.
Wow.
And it's really in the act of giving that we all heal, that we all elevate. And
Oh.
it is such a blessing for all our own existence.
Mm.
And God charged us with taking care of this vessel, of caring for this vessel.
Yes.
And it's our duty to do. And you are rewarded in unimaginable ways when you
Yes.
pursue health and you take responsibility and you own your health.
Oh, that is so true. Be that reward, and that reward is happiness, abundance,
Mhm.
connection,
All of
and
it.
even, yeah, all of it. Dr. Jen, this was such a delightful conversation, a very necessary one. Thank you for addressing the inaccuracies we've been shown about our health, about cancer, about some of these screening devices, the mammogram, and introducing a very disruptive yet very empowering, take charge kind of way to navigate our own healing and health journey. And I just want to say thank you, thank you, thank you so much.
You're so welcome. It was such a joy to be here with you today.
And thank you for joining us, everyone. Love you all. Mwah.